I'm Ritika here, and this video is about JC virus. Introduction. The JC virus was first discovered in 1971 by Zurin and Chow, and they isolated it from the brain tissue of the patient with progressive multifocal leukoencephalopathy. The virus was named after the patient John Cunningham, and it was typically transmitted through exposure to contaminated urine or other body fluids. Most people occur the virus during childhood or adolescence, and it usually remains latent in the body without causing any symptoms. Structure of JC virus. JC polyomavirus is non-enveloped virus with circular, and the genome is made of double-stranded DNA. The size ranges up to 5130 base pairs, and the virus is enclosed by an icosahedral capsid. The viral capsid is composed of 72 pentamers of viral protein 1 (VP1), each bound to either a single viral protein 2 or viral protein 3. The viral genome is well characterized and is composed of an early gene segment and a late gene segment. Epidemiology. Epidemiological studies on JC polyomavirus are sparse. It is clearly highly prevalent in the worldwide population. Seroprevalence falls at 60% of JC polyomavirus. JC polyomavirus seroprevalence begins at the rate of 10 to 20% in the childhood and increases steadily each decade with about 50% of adults. Clinical syndrome. Progressive multifocal leukoencephalopathy, PML, that stands for Progressive Multifocal Leukoencephalopathy, that was first identified as a unique pathology in 1958 as a complication of primary B-cell lymphoproliferative disorders. The all-known PML case result in multifocal white matter lesions in the central nervous system, and that was accompanied by the triad of histopathological symptoms such as demyelination, abnormal astrocytic morphology, and oligodendrocytic nuclear inclusions. The presence of inclusion borders in oligodendrocytes suggested a viral cause. PML remained a very rare disease until the mid-1980s when acquired immunodeficiency syndrome, that is AIDS, reached epidemic and eventually pandemic proportions. PML became an AIDS-defining illness, and 2 to 5% of HIV-infected individuals would go on to develop this uniformly fatal disease. Drug-induced PML. The two main risk factors for PML that remain are lymphoproliferative illness and AIDS. PML susceptible persons are a novel group brought about by the relatively recent development of potent immunomodulatory medications for the treatment of multiple sclerosis and other autoimmune illnesses. The majority of this category consists of people on immunosuppressants such as natalizumab, that is a monoclonal antibody intended to decrease the leukocyte trafficking into inflammatory tissues. Other related diseases. PML is not the only disease caused by JC polyomavirus. The virus can in rare cases lead to JC polyomavirus granule cell nephropathy, JC polyomavirus encephalitis, JC polyomavirus meningitis, and JC polyomavirus associated nephropathy. Granule cell neuronopathy is similar to PML in that it is caused by JC polyomavirus infection of the brain. Although in granule cell neuronopathy, the virus infects the granule cells of the cerebellum instead of oligodendrocytes or astrocytes. Symptoms of JC virus. Once it is activated, JC polyomavirus causes a lytic infection in oligodendrocytes and astrocytes in the central nervous system by affecting cells that are vital for neuronal stability. The infection of oligodendrocytes leads to extensive demyelination, resulting in neuronal dysfunction and death. Because of the demyelination occurs at distinct points, Physical symptoms can minor several different diagnoses, including multiple sclerosis and stroke. Such physical symptoms of PML are diverse and include motor dysfunction, visual defects, and speech impairment. Some individuals with PML may develop seizures as well, while earlier diagnosis leads to better outcomes for patients. It is difficult to identify early stages of PML, which means diagnosis often only occurs once symptoms are already severe. Pathogenesis of JC virus. Initially, asymptomatic infection with JC paludism likely occurs via a fecal oral route. The virus is routinely shed in the urine and possibly in the stool. Initial infection via tonsillar tissue, though, is relatively rare, and there is a possibility of mother to child transmission. The transmitted form of JC paludism, which is found in urine and in kidney tissues, is not generally pathogenic. Although it is the most common strain of JC paludism, this form of the virus, termed the archetype strain, which establishes an asymptomatic state of persistent infection for life. Replication. The virus that binds to sialylated carbohydrates and serotonin receptors and then enters the cell by endocytosis. The DNA genome is uncoated and delivered to the nucleus. Then, viral replication requires the transcriptional and DNA replication machinery, which is provided by a growing cell. Permissive cells allow the transcription of late viral messenger ribonucleic acid, that is mRNA, and viral replication, which results in cell death. Some non permissive cells, however, allow only early genes, including the T antigen, to be expressed, promoting cell growth and potentially leading to oncogenic transformation of the cell. The virus is in the nucleus and the virus is released by cell lysis. Diagnosis of JC virus. A diagnosis of PML is made using initial presentation of neurological symptoms by magnetic resonance imaging, that is MRI, identification of contrast enhanced viral lesions, and confirmation of the presence of JC paludism DNA in the cerebrospinal fluid, that is CSF, of symptomatic patients. PML lesions associated with different underlying disorders may present differently in MRI scans, and while diagnostic criteria for using differentiating PML lesions for those caused by other diseases such as multiple sclerosis have been published, lesions remain difficult to diagnose, particularly for individuals who are initially asymptomatic. Treatment of JC virus. There is currently no specific antiviral drug against JC paludism, but use of antiretroviral drugs in HIV patients and early detection and monitoring have played a significant role in reducing PML mortality. Thank you.